Are you ready to take your business to the next level? Every day there are countless books and articles that are published offering the key on how to make your business a success. It's easy to feel overwhelmed trying to keep up and run your business. That's why Deb Creer created the Business Power Hour. Keep up on the latest trends, best practices, and techniques for how to make your business a success. Let the Business Power Hour do the heavy work for you.
Good morning. Good morning. I am Deb Creer, and I am passionate about giving professionals the tools that they need to make themselves and their businesses as successful as possible. And today we're going to be talking about a subject that, holy schmoly, I don't think we go an hour without talking about, even now. We're going to be talking about COVID-19 and, a lot of other things, but a lot about being healthy in your office, being healthy in your environment. We talk a lot on the program about business topics, but I firmly believe that if we're not healthy, if our customers, if our employees aren't healthy, don't feel protected, nothing else is going to matter. So we're really going to have a great time talking with our guest today. So please join me in welcoming Jonathan Bhaktari to our program today. Welcome, Dr. Bhaktari.
Oh, thanks for having me, Deb. What an honor. Thank you.
Great. Well, let me tell people a little bit about you. So today's guest, Jonathan Baktari, MD, is a healthcare CEO, a vaccine and COVID-19 expert, and a physician with specialties in internal, pulmonary, and critical care medicine. He and his team at E7 Health specialize in preventive medicine, vaccination, and testing for viruses. In short, Dr. Baktari was an expert on COVID before COVID even existed. I think we forget that it's actually called COVID-19. In addition to his expertise as a physician, Dr. Baktari is knowledgeable about the founding and growing of a tech business, having successfully done so multiple times. He is passionate about all things related to business growth and preventive health, and I am so excited to have him here today to speak with us. Welcome to our show, Dr. Baktari.
Oh, thank you so much, Deb. Excited to be here.
Great. Well, thank you for the short bio. I was looking on your website and oh my gosh, you are an overachiever. But I love it because you have had experience, as we said, in many things. So tell us, though, I always like to know from my guests how they got to where they are today. So how did you really discover that for at least right now, this is your passion in life?
Yeah, it's a kind of a journey. I mean, obviously becoming a doctor first and sort of developing that career. Mm-hmm. And, just sort of the way it worked for me is one mm-hmm. thing evolved into another. Mm-hmm. One door opened another. And, as long as I think I was always pushing myself to, do the next thing or learn mm-hmm. the next thing. And I think we just sort of evolved over time from mm-hmm. just, clinical medicine to administrative medicine mm-hmm. to entrepreneurial healthcare. And it wasn't one day, one morning. It was more like a slow evolution of, like mm-hmm. I said, one door opening up another.
Mm-hmm. Right. I love it. I love it. And, it just, kind of happened that, we all of a sudden went, or not all of a sudden, but we have this pandemic mm-hmm. and, we've talked about it, obviously, I can't do a program without talking about it. We focused an entire month of programs on it last year, but, things, one of my favorite things is when people say, I can't wait for it to get back to normal. Mm-hmm. Ha! It's not going to be January 2020. We are going to have changed. We're going to be expecting different things from right. employers, from the companies that we work with and work for. So kind of talk us through what this new normal is going to look like in the long term.
Yeah, I think the new normal is going to evolve, and we're going to obviously somewhat go back to the way things were, but also retain certain things that we've learned from all this. I think, we've learned that, the cost of close social interaction, you can pay a price for it. Mm-hmm. So this idea of, not having artificial situations where a large number of people gather mm-hmm. for reasons that could potentially not have to happen. You leverage technology. You know,
Mm-hmm.
I sort of come up with the scenario where people go to a conference and they, at the beginning, all line up to get their badges and some long queue. I mean, obviously we have technology that could address that. And I think to the extent that, you know, technology is going to remove some of those situations, you know, do you really need 100 people to queue up to buy hot dogs at a football game?
Mm-hmm.
You know, is that absolutely necessary? So I think some of that is going to be part of the change and solution, where this whole idea of having, you know, large groups of people, especially indoors, we're going to have to pay closer attention. One thing that really fascinates me a lot about this whole dilemma is we spend the last 20, 30 years, you know, for example, in our drive for clean energy and energy efficiency, by making buildings very efficient.
Right.
And the way you
Which
make them
means
efficient,
sealed.
sealed, right, right. So I think balancing that need for energy efficiency versus ventilation, and letting outdoor air to come in and ventilate and exchange air and what have you. And of course, there is technology that can do both. But I think some of the things, that's just an example of how, you know, things that were our priorities will now have balanced other priorities simultaneously, if that answers. So I think that's what we're looking at, the new normal, sort of looking what our priorities were and adding these other priorities to it, and addressing some of those things I mentioned.
Right. You know, and I think many businesses are definitely rethinking how they're going to operate. You know, from a cost standpoint, for many of them, if they can have a smaller space and have their employees at home, that's obviously a huge benefit to them. You know, there are obviously costs. They have to make sure that people have the right technology, you know, all of those various things. But, you know, I don't see people going back en masse to be in offices. You know, my husband was in an office that had, you know, many hundreds of people, and they've been told plan on maybe 2 days a week, but not even until September. You know, the hybrid situation, I think, is really going to be something that many businesses embrace.
Yeah, you know, but I think that's going to raise a new set of problems. And honestly, if there's one area that I have a contrarian point of view on this, is this working from home. And I think what I'm hearing and seeing is that, you know, not every employee is going to be the same rock star they were at work as at home. I mean, and I think we're fooling ourselves if we think, you know, that 100% of the time, every employee is going to go home and never play with the dog or take an afternoon off. Or I think we're just deluding ourselves. I think that's what people are finding, that it was really romantic during the pandemic to talk about, people will forever work from home. And but I just don't see, when you look at, if you have 1,000 employees and you send all 1,000 home, not all 1,000 of them are going to become all of a sudden even more efficient. You're going to have a certain percentage that their productivity, creativity, whatever, is going to go down. And I think that needs to be addressed. Of course, I think some people just, their job lends itself to working remotely. The other thing that people forget is really, you know, I don't know what the percentage is, like 50, 60, 75% of the population can't work remotely. If you're in transportation, if you're in hospitality, you know, if you're in construction, you can't work remotely. So I think there's a certain romanticizing about this remote worker, because I think it's only a small percentage of people that physically, if you're a cashier at Walmart, you can't work remotely.
You have to be at Walmart.
You have to be at Walmart. And so I think there was an romanticizing that concept because of necessity, because we had to work remotely. My sense of it is some of the problems with working remotely, not only productivity, but the lack of creativity, collaboration, accountability. Yes, we can use technology to overcome some of that, but no one can really, with an honest, you know, face, say, "Yo, no, it's going to be 100% as collaborative." Yeah, there's certain things that you can't get out of a Zoom meeting, certain interactions, certain collaborations, and you know, some of the best ideas, you know, I think in many companies occur at the water cooler, or employee lounge, or what have you. And so I think there's going to be a potential pushback at some point to some of that. Clearly, certain jobs were always meant to be remote, or it's optimal for it to be remote. But I think it's not as romantic as we think. Again, for a small percentage, yes, but this idea that the large swath of the workforce will work from home may not be as plausible as we think.
Right. You know, and it's obviously just a total guess on my part, but I'm thinking we probably have another year where we're still shifting. We're still trying to figure things out. You know, I think we very well may have, another, I hate to say shutdown of everything again, but, it may happen, things like that. But, more than anything, we're social creatures. Right. I don't miss putting on my shoes. This has been my running joke. Going into meetings, driving in traffic, I don't miss any of that, but I miss the people. And I think we've seen certainly a huge issue with that with kids. Kids have got to be around other kids.
Yes. No, I totally agree with you. Just to kind of tangentially touch on what you're saying, though, one of the good sides of being remote is, like, look at all the business travel that we found was unnecessary. I mean, like, literally you can meet with 5 companies in one day, as opposed to flying to 5 different places, let's say, if that's what you were doing. So I think, and you're right, with the kids, getting back to what you were saying with the kids, I mean, they're really, I always joke that you can always get them a tutor for math, or you can always get them a tutor for, whatever, but you can't get a tutor to teach them social skills and how to collaborate and interact, whatever. So, if they fell behind on their history or their math, so you get a summer tutor, or you get a tutor in the evenings, but how do you make up for a lack of, social skills or what have you?
Well, and, I'm a big supporter of things like band, choir, sports, and clearly those you have to be with other kids.
Right. That old adage that it takes a village to raise a child. I think that really comes out in this pandemic, because what that really means in today's term is, like you said, the band teacher is part of the village. And, and this whole thing that you can't just raise a child with just the parents. And it does take a village, because they look at the band teacher or the choir teacher or the other students that are interacting, and, there's lessons to be learned there. And so if you don't allow that, you're raising the child alone, and the village is not there to help you.
Right. And unfortunately, not every parent is able to help their kids with their schoolwork. We first, there are many kids who, from a technology standpoint, were just going to struggle. They might not have even had the technology to be able to be, remote learning. And then, their parents, for, many, many reasons, might not have been able to have been helping them with their studies. They might have been working, and or just not have that knowledge. Somebody who might be able to help with math might not be able to help with history, and so that's, I think, been one of the issues that a lot of parents have seen. Now, I say that not being a parent, but, I have friends who are parents who have said, it's really hard. And I had one that said, oh my gosh, I've learned so much.
Right. You actually learn yourself. Right. Yeah, no, I think you're right. This pandemic taught us so much about our children's education, what's involved in that. It's you realize how complex it is, and it's not as simple as just them acquiring knowledge, right? Right.
Yeah. And then there are obviously the kids that need extra help, on both spectrums. I have a friend who has a child who is gifted, who has actually been doing much better one-on-one, but at the same point, they realize that, sometimes the gifted children are the ones that most need the socialization, and some things like that. But so it's going to be interesting with schools to see what happens, especially in the fall.
Yeah. When I look at college students and stuff, you can, by the time you get to college, you can, get extra help, study
Mm-hmm.
harder, whatever. But if you didn't acquire the social skills by the time you get to college, that's where it's going to be tough. So I
Mm-hmm.
totally agree with that. It's just, you almost, I don't want to say the education is secondary. It's not.
Mm-hmm.
Getting a great education in elementary school is important. But a lot of that you can make up for
Mm-hmm.
whatever, but you can't
Mm-hmm.
make up for the other stuff. So
Right.
I agree with you totally. Yeah.
Right. And we've all seen, the information that the grown-ups are struggling with this too. I mean, the nice thing is we are getting back, we're socializing again, we're seeing people, but it was very difficult for people for quite a while.
Yeah. No, I think people, it's not like you had another pandemic to remember what you did last time.
Right. Yeah. Most of us didn't live through, through another one.
Right. So it was like we were all learning for the
Mm-hmm.
first time. So
Mm-hmm.
I think, just figuring out, how this is going to work and,
Mm-hmm.
What's optimal for your job, for your
Mm-hmm.
family, for your career,
Mm-hmm.
and what's important to you. And
Mm-hmm.
it's interesting, like all the new hobbies people took up during
Mm-hmm.
this thing. And, so there's a lot of course, silver lining too.
Mm-hmm.
People spend more time with their kids and
Right.
family. And
Mm-hmm.
yeah, but obviously it was a horrible thing. But yeah,
Mm-hmm.
it's quite, I think I've said this before, I think certain generations are defined by something.
Mm-hmm.
Like, we all know people who survived the Depression and
Mm-hmm.
became real misers and
Mm-hmm.
would buy one car and run into the ground for 20 years because
Mm-hmm.
even though they had the money, but they
Right.
survived.
That's just,
it,
yeah. Mm-hmm.
it just impacted the
Mm-hmm.
way they
Mm-hmm.
operate. And people who survived World War II, came
Mm-hmm.
out of it and they had a certain way and
Mm-hmm.
mentality. It generationally impacts that whole group,
Mm-hmm.
and that's sort of how I view this pandemic. That everyone coming out of it, even though they may not realize it, I think they will be
Mm-hmm.
forever changed for it in ways that they can't probably
Right.
even put their finger on.
Mm-hmm. Hopefully we all remember how to wash our hands.
Yes,
that's been one of those things. I'm like, really? We all had to be taught that again. And the sad thing is we did.
Right. We went to catching viruses and colds and,
Mm-hmm.
I say, hey, you know what? I haven't caught a cold in a year
Mm-hmm.
since I've been wearing this mask and whatever.
I
So
know.
it reinforces some of the things we should already know.
Mm-hmm. Right. But you talk about, generations that will remember this. I was just looking at a friend's Facebook post, and she has a young daughter, and they were going to the store, and the mother, did not have her mask on. And the little girl was very upset. Mommy, you have to put your mask on. And she kept trying to explain, no, it's okay. I've had my shots. I don't need to. But it really upset the little, because that was what the little girl had gotten used to. And she knew that made mommy safe. And that's going to be one of the hard things, is kind of backing down from that. And then it doesn't help matters that sometimes we're told to wear masks, sometimes we're not told to wear masks. I mean, that gets confusing too.
Yeah, no, I think the back and forth on the mask,
Mm-hmm.
and truthfully, not even children. There's certain adults that
Right.
feel like, hey, maybe we shouldn't give this mask thing
Mm-hmm.
up too quickly,
Mm-hmm.
and what have you. And they're just so used to it. But yeah, I think part of it is the science wasn't clear, but I think
Mm-hmm.
even after the science was clear, we could have done a better job of being more consistent.
Right.
So, and I think some of the inconsistency, at least from the CDC, and I sort of, in our world, we look at public health, and public health is different than a person's health. So when you
Mm-hmm.
go to a doctor, he gives you advice based on what's best for your health.
Mm-hmm.
But when you're the CDC, you're not giving advice on what is best
Mm-hmm.
for Deb necessarily. You're
Right.
giving advice for what is best for the population.
Mm-hmm.
And sometimes they're not the same. And I can
Mm-hmm.
give you an example of examples of that. What's good for Deb, okay, or what's optimal for Deb
Mm-hmm.
or me, is not necessarily optimal for the population.
Right.
So sometimes that's where the mixed messages come.
Mm-hmm.
They'll give you a directive that's not meant for you,
Mm-hmm.
but you'll have to comply with it because
Mm-hmm.
it's good for everyone. And like the most glaring example of that is the mask. I mean,
Mm-hmm.
we knew very early on that if you were vaccinated, you actually didn't have to, wearing a
Mm-hmm.
mask wouldn't change much for you.
Right. Mm-hmm.
But come January, February, when the vaccine was out,
Mm-hmm.
you, from a public health point of view, you couldn't really say that,
Mm-hmm.
because if you said to people, listen, you don't have to wear a mask if you've been vaccinated,
Mm-hmm.
well, then all the people who were not vaccinated, how would you sort them out? So
Mm-hmm.
if people walk in the Walmart, once you say you don't have to wear a
Mm-hmm.
mask if you've been vaccinated, how do you regulate
Right.
who walks into
Yeah,
a
there's a
restaurant?
big faith and trust.
Well, so from a public health point of view, I think the decision was made, okay, let's force everyone who is
Mm-hmm.
vaccinated to wear a mask to make
Right.
sure everybody who wasn't vaccinated wore a mask,
Right.
until the numbers got big enough
Mm-hmm.
that, okay, so that public health need
Mm-hmm.
to force people who are vaccinated to wear a
Mm-hmm.
mask is no longer there. So
Mm-hmm.
so some people say, why didn't you tell us back in March or February that we
Mm-hmm.
didn't have to wear a mask? I think they knew. I just
Mm-hmm.
think they just said, but even though we know from a public health
Mm-hmm.
point of view, we'll force everyone to
Mm-hmm.
wear a mask to make sure the unvaccinated people
Right.
wear.
Yeah, because it is a trust issue. When I got my little vaccine card in January, of course, my first thought was, hey, I could make these on my computer. I mean, it was that basic. And, and so then I thought, ooh, if I'm thinking that, other people are thinking that, because, I wouldn't do that, but, other people would. And we do have to take people, even if they show you their card, I mean, we're still trusting that it's true. And I've had that discussion with people, because I do have a compromised immune system. I have health issues. And I tell them, if you don't take the vaccine, I'm fine. I don't care. It doesn't matter to me if you take the shot or not, but do not lie to me about it. And because then you're jeopardizing my health, and I could potentially be jeopardizing your health. But that is where it gets tricky, is when we have to trust that the person who has a mask off has had their vaccination.
Yeah, I mean, and I think the people who don't want to get the vaccine and don't want to wear a mask, those people exist. And so, yeah, I mean, I think we're not going to get around that. I think what's interesting, though, is I think a lot of people who have not had the vaccine are probably statistically eventually going to get COVID anyway. So in essence, they're going to get immunity one way or another.
Right.
I mean, you look at the number of COVID cases in the US already. I mean, I think it's almost fair to say a third, if not more, of the population has already gotten COVID. So if you don't wear a mask, if you don't get the vaccine, statistically, you're more than probably going to get COVID at some point anyway, if you haven't already gotten it. So I think this whole idea that I'm not going to get the vaccine and I'm not going to get COVID,
unless you're a hermit.
yes. So I think those are the issues. I think people who don't want to get the vaccine don't want to wear a mask. They're at high risk to getting COVID anyway. So
and hopefully, if they do, it's a very mild case. And and that's the other thing, is statistically, most cases are annoying. It's mild. You're not being hospitalized, and so people are rolling the dice that that's going to be them. And really, that's what it comes down to. But obviously, folks, talk about this with your doctor. But like my doctor, I have several. I'm one of those special children that has lots of doctors, but mainly my oncologist has said, you wear your mask. And I'm fine with that. Of course, now I have ones that go with every wardrobe, which I'm sure really aren't exactly working all that well, but a mask reminds me to keep my distance. I mean, that is more than anything.
Yeah, no, I think we learned that even catching a cold or catching a flu, the mask is going to help with that, and the distancing, the hand washing. So
I mean, look how many flu cases there were last year. I mean, it was infinitesimal.
Right. So because, the flu is transmitted essentially the same way as COVID-19.
Right.
The same mode of transmission.
Yeah. And I do find it interesting when people take offense at somebody wearing a mask. I had people at the start when I was really being good about wearing my mask. I had somebody, and I've shared this before in the program, where I was coming out of Walmart, I had my mask on, and this man makes his face, and he says, "You must be a Democrat." And I said, "No, I must be a cancer patient." And that stopped him in his tracks. I mean, he said, "I'm sorry." I said, "Think about that the next time you get snarky with somebody." Wow. But, I had somebody, and this was less than a month ago, we've got a big walking trail behind our house. And so we were walking, and I was still wearing my mask. I mean, I am delicate. And so I was, and Georgia is still under 40% of people having vaccinations. So, the majority have not. So I was wearing my mask. And this grumpy old man, and he's one of these, you look at him, he's a grumpy old man, right? And he said, "Why are you wearing that?" And I looked down at my shirt because I'm thinking I must have a t-shirt on that, he didn't like whatever it was saying. And he said, "No, why are you wearing your mask?" And I said, "Because I choose to." And he said, "No, why are you wearing it?" And so I kind of started going through I have a compromised immune system, blah, blah, blah. And he kept taking offense. I mean, he was not happy that I was wearing a mask. And I finally said, "I'm sorry, what business is it of yours? And more importantly, what's the harm? I mean, I'm not harming you by wearing a mask." And then, he huffed off and he was mad. But those type of things just totally perplex me.
Yeah, no, I mean, I think globally it's the politicization of mask wearing and other things involved in the pandemic. I mean, I really think there should be just one approach to the pandemic, not a liberal or conservative.
Right. Yes. A health perspective.
Science perspective, a health perspective. And yeah, I mean, and I think some people see those inconsistencies that came out of, the government because they were trying to address public health, not private health, if you want to call it that. And people interpret that as a political statement versus, oh, I see, we're doing something for public health's sake, which is not consistent with the science for an individual, but it is consistent with the science of public health.
Right.
Does that make sense? So I think no one's really explained that to enough people, that we're not talking about what's the science for one individual. Right. We're talking about what's the science.
Yeah, the average.
Yeah, to protect public health, globally, not just in one person. So I think we need to do a better job of explaining that.
Right. I was just wondering, do you think it made a difference that this was, in essence, a new disease? I mean, it was the 19th version of this. But, if it had been the flu, if it had been chicken pox, if it had been something that we were all used to hearing about, if there'd been, mass outbreaks of that, do you think that would have been treated differently than, oh, there's this new disease?
Yeah, well, I don't know, but I think what's startling about this versus, just your regular cold or regular flu is the significant mortality attached that it had with older and people with risk factors. Mortality was significant. And I think the other thing is how contagious it was. If we're assuming, in the span of 1 year, a third of Americans got it,
that's really contagious.
That's pretty contagious. I mean, but then, that number really does pan out based on your own experience. I mean, if you think about your bookkeeper and your hairstylist, if you factor, almost like 1 out of 3 people, most people got it. And so I think that's what makes it different. I think the sheer contagiousness of it, the number of people that got it, and also the mortality rate among the older population and people at risk.
Right. Well, and things went downhill quickly. And that I think was one of the things that startled people too, was, hey, this is out there. Oh my God, we're shutting down everything. And I mean, people went to work on Friday and didn't go back to work on Monday. I mean, that was a very strange concept for people. And, I think that, that was part of it too, is it caught us kind of off guard.
Yeah, no, I mean, it's not like someone had survived, like I said, the previous pandemic. And oh, here comes another one. I just think it just wasn't in the cards. And I think, it being Monday morning quarterback, you can kind of look at it all and say, I mean, did we need to do all of that? Could we have just, asked the people at risk to stay home and kept the economy going? What else could, and I think the fact that no one had been through it before made it tough.
Right. Politics aside, we hadn't gone through it before.
Right. It wasn't like this is the playbook for handling a pandemic.
Right. And maybe that was it too, was we really didn't know. And I think whether people wanted to admit it or not, they were scared. Obviously we didn't shut down as much here in the United States as they did in some other countries. I interviewed a gentleman for the program who lives in South Korea. And actually, and I was just kind of asking him about it. And he said, well, we shut down and we shut down hard. And he said, but we have, not a lot of cases here. And I kind of laughed. And he said, you need to understand, if you went out, you got shot. I went, oh, all righty then. And he said, so when they told us stay home, we stayed home. Clearly that wasn't going to happen here. I mean, that just, but even countries, like European countries that shut down really hard, it was interesting. Of course, it was interesting when we look at, well, this country did this and this country did that. And, why are we doing this? Or even states, we would travel to a different state and nobody was wearing a mask, all sorts of things. I mean, that was part of the confusion.
Yeah, and it's still going on. I mean, there's still certain states that you can go to, and it's much different than going to other states. So I think leaving it up to the states, which on some level makes sense because they know what's going on locally.
They've got the resources,
versus, but it really, it just everyone had their own recipe for how to deal with it based on either their politics, what's going on in their state, their demographics, what have you. It was a hodgepodge, right?
Right. And then when you got clearly misinformation, I mean, that was a big part of the issue too. That people were saying, I mean, like, I know people who still say it doesn't exist. I'm like,
oh, really?
All righty then. You can't I give up. I mean, I know there's no way I can have a discussion with them. But yeah, it's, and it is nice that things are getting better. I had mentioned to you before the program, I went to a wedding last weekend. Everyone was required to have a mask. We were outside, so that helped. Now it rained a bit, but whatever. And it was so nice because knowing that everyone there had their vaccines and we were outside, I didn't wear a mask. And it was so nice to see smiles. I mean, that was one of the things. Now, I didn't hug a lot of people. I still kind of kept my distance. And, and I'll be honest, I had talked with my doctor before I went, and she's so funny. I love my oncologist. I have unfortunately been with her for 6 years, but, when I go do things, she's like, if I tell you not to do it, you're going to do it anyway. So I just tell you to be careful. But yeah, she had said, just be careful. But the airport, the planes, those made you a little nervous, because there was no social distancing, and you're sitting right next to somebody that you have never met. I mean, that was a little spooky.
Yeah, no, what's interesting about the airplane is the ventilation is quite good on a plane.
Right. Yeah, you're probably safer there than in most places.
It's actually they exchange there quite frequently. But theoretically, you're very close, and you don't know who you're sitting next to. So, but if done properly, the ventilation is pretty good on when the air conditioning is really running.
Right. Yeah, it was more, when you're in the lines for security.
Yes.
The plane trains, I'm here in Atlanta, and, plane trains, you're just mushed in there like little sardines. And so, that makes you nervous. And the bad part is that we're now nervous. I mean, you hate to think, oh my gosh, is this going to be the way we continue? In fact, I've had people who have said, are you, especially with my health history, they have said, are you scared?
Yeah.
I'm cautious. I
mean,
yeah.
It's really amazing because now, like, sporting events have started up again, and, like hockey playoffs and what have you. And there's 18,000 people.
I know.
And no mask, no nothing. And so, yeah, it's, part of it is a really testimony to how well the vaccine works, because at the end of the day, out of the 100 million people, or more than 100 million people who've gotten the vaccine in the US, like literally there's been like 10, 20 deaths in that group.
Right.
Which basically means if you get the vaccine, both doses, you're not dying from this, at least based on the current variants that are out there. So that gives people a lot of, latitude to saying, I'm pretty much, the pandemic is over for me.
Right. Yeah. And we were talking before the program, there are people that vaccines in general, they're cautious about, sometimes overly cautious, sometimes, kind of odd cautious, and I understand with the COVID vaccine, people thought, well, oh my gosh, they came up with this in a month. Well, not really. I mean, it is COVID-19. And so talk to us about, about the caution that people have regarding vaccines in general.
Yeah. Because, as there are like Facebook groups of people who don't believe the vaccine works or what have you, or don't want the vaccine, and anti-vaxxers and whatever. Well, it's an interesting category, this category of vaccines, because you don't see this like with chemotherapy. There's no Facebook group says, we don't believe in chemotherapy. Right. We don't believe in antibiotics. There's no group of moms that says, I'll never give my kid an antibiotic. I think it's just this thing from the pharmaceutical companies to spend money, but you hear that about vaccines all the time.
Right. And a variety of the vaccines.
Measles. You name the vaccine, there's a group against it. There's no group against migraine medications.
Right.
There's no group that's against
aspirin.
Why is there no group against that? And people are pretty perplexed. What is it about vaccines that lends itself to people becoming like that? And the only thing that really is the answer is vaccines are one of the very few things that we give you that we can force upon you, like especially childhood school vaccines.
Right.
When the government doesn't say you need this chemotherapy. The government doesn't say you have to get this migraine.
Right.
The government doesn't say, so anytime the government tells you have to do something, there will be a small percentage of people who say, aha,
what are they doing?
Yeah, what are they doing? And because otherwise, if there was some natural, inclination against vaccines, there should be natural inclinations to other groups of medications or what have you. So in fact, vaccines are much more natural than aspirin or Tylenol or antibiotics and what have you. So I think that's where it comes from. It really is this, it's mandated for like elementary schools and what have you. Once you get there, then it just, there must be something to this.
Right. And it's funny, I did have people, when I took chemo, that questioned whether I should or not, but it was more that I could do it from a holistic point. And it's interesting. I did, and long story short, I had one chemo dose, about killed me. It really did, about killed me. I was in the hospital for 7 weeks. So it was not a good thing for me to take, but and so I've had to do different things. But a friend of mine, she had called and she was diagnosed with breast cancer, and she said, she wanted to talk to me specifically because I had issues. And I said, okay, first of all, it's a very personal decision. You need to I said, get off of Dr. Google, talk to, talk to your doctor, all these things. And she said, I just don't believe that doing that is going to help. And I actually worked for an oncologist many years ago. And he said, 99% of treatment is in here. It's in your head. And he said, if you believe it's going to help you, it will. If you think this is horrible and awful, it's going to be horrible and awful. And so I told her, I said, you have to go with what you feel is best for you. And so she did have surgery. She did that, but she chose to not have chemo. And did holistic, changed her diet, all sorts of things. And then she had a recurrence. And she called me again and she said, what do I do? And I said, again, you need to do what you feel you should do. You need to base it on, education and things like that. And I said, I can't tell you what to do.
Yeah. Well, I mean, maybe chemo is not a good example because there are chemos that work and don't work, and
right. And just weird stuff. But,
right. But even things that we know for sure works, like antibiotics.
Right. And chemo works 99.9% of the time, whether you like it or not.
Yeah. Some chemos work, and they work to a certain extent, but even things that are 100% work. Like if you have a skin infection, you take an antibiotic,
right?
It's going to work. And I think vaccines and antibiotics are probably the same. 95% they're going to work.
Right.
But what is it about vaccines that doesn't have a Facebook group? I mean, why is there no Facebook group against antibiotics?
Right. Right. And granted, there are people who, for religious reasons, don't, but that's different. And it's funny because when I was growing up, and I think you and I are fairly close to the same age, we just got our shots. I mean, we lined up in the cafeterias, right? And I remember getting the TB tests on my arm. And we didn't think anything of it. It was just, today's shot day. And we went down and we got whatever the shot was. And then you go home and there were some parents that went, oh my God, what they do. But yeah, I mean, it was very interesting, just the differences in time too.
Yeah. And I think the acceptance of vaccines on some level has improved because we now, the vaccines today are much safer than the ones we took as children. They're much more pure, much less side effects. So we've gotten much better at producing a better product. And so on some level, the acceptance is better. But I think the holdout group is still there. And I think it will always be there for any vaccine because I think of this, it's a category that's tarnished with this label of, it's a product that government forces to get on some level. So that's where that comes from.
Yeah. And as with any of it, I mean, there are going to be the rare cases when something bad happens.
Yeah, but so does with antibiotics.
Yeah.
There are cases where nobody is against antibiotics. I mean, every Tylenol causes a lot of deaths every year. No one says let's abolish Tylenol or I'm not taking Tylenol. I think even the side effect, in fact, the side effect profile of vaccines tend to be a lot safer than some antibiotics you can take.
Oh yeah.
So I don't think it's even the side effect profile that's doing it. The side effect profile feeds into the narrative of the people who don't like the vaccines to begin with.
Right.
But yeah, I mean, you can have general anesthesia for a routine appendectomy
and have a problem.
Yeah. So I think any doctor that says this procedure, this medication has no side effect, which I don't think anyone would tell you, is not true. So same thing with vaccines. The question is on balance, is that benefits outweigh infinitesimal risk.
Right. Definitely. Well, one of the things we talked about is there were good things that came from the pandemic. And I think one of the things is obviously the increase in a lot of technologies. I have a nephrologist that I have never seen in person. That's always I have to move the camera, show my ankles, all the, so that they're, but you started a tech company, so tell us a little bit about what E7 Health does and, kind of how that operates.
Yeah, it's so funny. We started E7 about 12 years ago, and we did it as an adult vaccine company.
Okay.
Just said, there's a whole array of vaccines that adults need and should get, whether they're traveling for their job, for their general health. And, everybody who was giving out these adult vaccines was doing it as a side hustle to whatever else they were doing. urgent care, there were primary care office. There was always like a side hustle.
Right.
Like,
Yeah. That's how I got my tetanus shot. I go in for my annual checkup and she said, hey, when have you?
Yeah. Yeah. But, you know, I hate to say it, but that if they're giving out 3 tetanus shots a month, yeah, I'm not saying with you, but just a lot of those are expired vaccines. They're not checking.
Right.
They're not giving it properly. They're not trained on it. And so because it's not their thing, that's not their shtick, right? They just, and so what we found is there was really nobody who was taking adult vaccinations and doing it as their main hustle, if we can call it that, and not make it their side hustle.
Right.
And could we then wrap other services that went along with the vaccines, like testing for viruses before you got the vaccine, you know, and also physicals that were related to the vaccine, a whole array of services, TB skin testing associated with people who need vaccines, and for employee health, student health, and travel and what have you. And so we just came up with a model. And I think the temptation for us was at the exclusion of doing primary care, urgent care. So our model was if somebody came into our clinic and they had a migraine or their stomach hurt, we wouldn't see them. We literally would, because that's not what we do. And so, and then we said, what happened? There was no software to do what we did because there's just nothing that we were basically creating a specialty itself. And so we slowly, you know, we started playing with writing software. And the more we did, the more we realized we had to do and to really improve patient outcome, patient satisfaction, and staff satisfaction, and reducing friction in the system. So we really became a software development company and a technology company in trying to address our own needs. And that's how we got to where we are, where, you know, we have 10,000 positive reviews on our website. And that's really a testimony to our software technology and of course our staff.
Right. I love it. You know, and clearly a lot of those things, especially in the last year, really ramped up. You know, and so, you know, how did you, because, you know, we've heard lots of companies that obviously had issues. How do you deal with a company that, you know, I'm guessing had some pretty rapid growth?
Yeah. So, well, I mean, one thing that made it easy for us is we were already giving out vaccines for other things and testing for other viruses. So testing for COVID, you know,
you just added.
We just added it to it. Like we were testing for herpes virus. We were testing for hepatitis A virus. We were testing for hepatitis B virus. We were doing all this titers and testing and what have you. So, you know, a lot of people that became COVID companies or got into the COVID business had to pivot. We didn't really pivot.
Right.
Like we said, now we did have to, we launched nationwide COVID testing at home, and so we had to set up new technologies and expand our software to get the results, and people could order and what have you. But it was an extension of a team we already had in place, as opposed to pivoting and saying, you know, we're going to go into the COVID business, and you know, we're going to go into the hand sanitizer business all of a sudden because that's hot. And you know, we were selling scarves, but now we're going to sell hand sanitizer. You know, I mean, it wasn't like that. It was an extension. So luckily we had the team and most of the technology in place. So it took work. I mean, we worked hard, but it was in our wheelhouse.
Right. You know, and I think there were many companies that, as you said, you know, they just went, hey, let's do something different. You know, I laugh at, you know, the companies that made alcohol, like drinking alcohol, and, you know, and all of a sudden we're making hand sanitizer. I'm like, okay.
Well, that's the pivot I'm talking about. This sort of pivoting, like how can we, you know, cash in on the COVID business versus, no, this is what we really do.
Right. Yeah. And, you know, I mean, it was nice that those companies were still able to keep their employees employed, you know, and things like that. But yeah, you know, you did kind of wonder, okay, you're doing what now? and of course, then the thought was, okay, when we're not needing those things, are you going to go back to what you were doing? You know,
and also you should ask yourself, you know, if you weren't in the hand sanitizer business before, you know, what kind of product are you really going to put out? So, you know, I know people literally that would, you know, sign up with companies that were dumping large tubs of alcohol into these huge drums and then and then reselling it to companies who would then resell it. And it was this whole operation. Obviously, it's not like they've been doing this for 20 years and have all the quality control and all the processes. So, you can't help but be concerned that you're not getting potentially the product you think you're
right. Is it really doing what it's supposed to be doing? I think a lot of people thought that with masks. It's like, is this it's as thick as it should be, or whatever. And I mean, we saw that. Like I said, I have masks that match my outfits, and so some of them are, clearly one layer. They're not going to do much, but yeah, it was interesting, and it was interesting to see places like restaurants that there's one just down the street from us that built a drive-through. I mean, they didn't have one before. They were doing, well with takeout and with, delivery services, but then they built a drive-through. They're clearly going to keep that drive-through, and so that was kind of an interesting, pivot that they made.
Yeah, they adapted, huh? That's all about adapting.
Right. Yeah.
Keeping business alive during COVID.
Yeah. And I think what this has shown all of us is that we have to be able to adapt, and those that didn't, did not survive.
Right. No, and you're right. And maybe, it's kind of like, the old adage that, when you get comfortable with something and you stop innovating, right? You're just like, and, how many times do we really, I see interviews with people who started up really amazing companies, but only after they got laid off. We're like, well, why did you start this company when you weren't laid off? Well, because once you got laid off, it was the impetus
right. It's like, oh my gosh, I need to pay my bills.
Right. So let me really. So yeah, I think innovation sometimes comes out of necessity.
Right. And I think we have seen people who have started new companies. They've started doing, second jobs, and not sometimes even out of necessity. I think there have been a lot of people who went, oh, now would be a good time to make a change. And so it's kind of forced them into doing some of those things that they might've wanted to do all along, but just needed that nudge.
No, you're right. I think we get comfortable, and it's the changing of things that kind of throws you over the line and says, I'm going to do it. And even like new hobbies people took up, like they would never have done this, or they would never remodel their house or whatever, or their garden.
My neighbors built a pool.
Yeah, like whatever. Right. We have time. We're looking at the pool now. So I think, I hate to say it because this pandemic's obviously cost a lot of lives, a lot of misery and whatever. But, on some level, there are small streaks of silver lining here and there.
Right. Right. Yeah. And we see that with, like all of the online networking, with the new businesses that have come up. I mean, there definitely are a lot of things, and you see that with anything. I mean, you want to go back to, say, World War II. I mean, the things that came out of that. Yeah.
Well, look at the suburbs. The suburbs came out of World War II. It's when the GIs came back, they had no place to live. Boom! All of a sudden, the suburbs were created. Yep. I mean, these historic events lead to unbelievable changes that may not occur for a lot longer.
Right. Well, Dr. Bhaktari, we only have about 5 minutes left, and you've gone through several things in your career. What's next? What do you think you're gonna, what kind of leads next for you?
Yeah, we really want to grow our technology. We want to innovate. We really want to see how far we can push the envelope in changing healthcare in ways that people may not have thought of before. I think what we do at E7 is we look at ways where we can not only improve quality, but how can we change the user experience? So when you're going to a doctor's office, you're not handed that clipboard with 12 pages to fill out at every doctor's office. And, whenever you need your medical records, you got to call, get it faxed. How do patients get complete access to all their health care? How do they book appointments, show up, do everything?
From my watch, right?
Literally. And that's where we are, and that we're pushing the envelope, doing more technology development. even more. We're completely paperless, everything. We don't have a medical records department because their patients own their medical records, access to it in their portal. We don't, no one ever calls us and says, I need that lab result. I need this. And so those are the ways we innovated. We literally developed technologies that the patient's the user experience is they own everything and they have access to everything and they can schedule anything. And we want to go even more in that route of empowering the patients while improving quality.
Right. And obviously that's important is, we have to, that the quality has to improve in a variety of ways. I mean, I'm a long-term patient. I go to lots of doctors and, it's interesting when I compare and, the pandemic or not, it's always been very interesting to see, the differences in offices, the differences in this provider, that provider. I have been incredibly fortunate that I have very, very good insurance, and so that has made a very big difference. But yeah, I mean, it's always interesting to me. It's like, well, I had to do this here. Why didn't I have to do this here? And
yeah. No, it's not uniform, and that's what we're trying to change. We're trying to develop technologies that the user experience is the same no matter what, and that's really where we want to push to.
Right. I love it. Well, for people who want more information about your company, where do they go?
Well, they can go to e7health.com or go to my website, BhaktariMD.com, or just on LinkedIn. Feel free to connect on LinkedIn with me, and those are really great ways. And if there's anything we can do to help, we will.
Perfect. I love it. I love it. Well, this really has been a great discussion, obviously very timely. And maybe in a year, we need to have you back on again to talk about, where we have gone. Because it really, who knows what is going to happen. Like I said, I've been happy that I haven't had any sinus infections for a year.
Right.
Right. Yeah. But yeah. So do you have any final words of wisdom for everyone?
I think the final words of wisdom is really, first of all, get your vaccine, because we already know that if you get your vaccine, it's impossible to die of COVID if you get your vaccine. Definitely get your vaccine. I think what we've learned from this is, we can leverage technology to improve our lives in ways that we hadn't thought of before. I think we're all going to be Zooming, even if we go back to work, instead of traveling as much. And so I think those are the things that's going to change. And if no new variant comes out, I think, in a year from now, yes, things will never be back to normal, but we will have some normalcy back.
Right. I love it. I love it. Well, I could continue this discussion because I'm just fascinated by it. I think it's very interesting. And as I said, we'll have you on again so that we can talk about, what has happened, now. Yeah. But until then, I'm Deb Creer. I've been having a great conversation with Dr. Jonathan Bhaktari, and everyone have a great day.
Thank you so much.
Tune in for our next program for even more trends, best practices, and techniques for how to make your business a success. The Business Power Hour, hosted by Deb Creer, is proud to be part of the C-Suite Network.